Hey everybody, I don't think I can be heard properly through this, so I'm going to take it off. But just a reminder, when you come in, if you come in for any services, please don't forget to wear your mask. It is required. Please make sure that you have an appointment, and please make sure that you are healthy and well. As much as we love helping people get well, we just can't have you in the office at this time, as you know, if you're not well. Talking about antibody testing. Yay, LabCorp came out last week. We've been waiting patiently because I, for one, have been very fascinated by all of this that has been going on. And I know that with the FDA and the CDC trying to work together and make the temporary, it's called EAU, emergency authorization used for certain aspects of what's going on. One of those is the testing. We are not doing the COVID test with the nasal and the throat swab here at the office. If you are ill, if you're sick, if you have any signs and symptoms, please contact your primary care provider or use one of the other services that exist. However, if you're curious, as we are, about the antibodies, which I will tell you that I got mine back, yay, and I'm very excited that this has happened. Labs all over the world and country have been coming out with different antibody tests, many that did not go through the FDA EAU process yet. Several have, most have not. So we've been waiting patiently before we came out and said, hey, we're offering that service to you, our patients and families and friends. What an antibody is going to tell you is whether or not you have been exposed and your body has made the antibodies. There's A, G, and M, A, and G, and they each represent a different value, which we'll go over later. But if you have these antibodies, it would just, for some of us, be nice to know. For some people, you might want to go and donate to help with the research that's going on, which across the board is doing a lot of different things with that information. It does not mean that you are immune to the virus down the road, but there is a high probability that you're it's greater chance that you are more protected than somebody who hasn't. But nobody can say for sure because, as we know, this is new, right? New. So what has happened is FDA and the CDC have said certain labs, please, yes, you are authorized to do these tests. This is a serology test. This is not a nasal swab, throat swab. Again, this is a blood draw. It's not a finger prick. It is a blood draw. And the FDA, I'm going to just be careful and read what the CDC and FDA are saying just to make sure that everybody understands. They want to learn look who has the presence of antibodies in response to the infection. And the antibodies can be found in multiple parts of the body, but right now we're just looking at serum or the blood. And it's an important reminder, you don't have to have symptoms to have the infection, or any infection for that matter, let alone or have had it recently. So what they're suggesting and what LabCorp is allowing and what we are doing is if you had any symptoms in the last 3 to 6 months and you're just wondering, did I? Maybe? You're a candidate for testing. A candidate for testing are all interested persons who have neither felt feverish in the last 3 days or experienced any other COVID symptoms, such as loss of smell or taste, shortness of breath, dry cough, feeling weak or lethargic, lightheadedness, dizziness, vomiting or diarrhea, slurred speech, or seizures in the past 10 days. Please don't come in to see us to get testing done yet. You need to wait a long period of time for some of the symptoms to subside before an office like ours is going to draw your lab work. As far as other people, some of you may have been around somebody in your house that you thought was ill. Everybody's better now, but you want to know. So we are welcoming you to schedule an appointment, preferably through our new online portal that we put out every couple of months. We are charging a very nominal fee for the service, and we're only going to charge the patients what the LabCorp is charging for these tests, and all of that can be found in the email. As far as your ability to pay through insurance, you can, as you know, we are not an authorized location for taking insurance, but you can always take the receipt you get from us. It'll be customized as best as we can to submit to your insurance companies. And a lot of other questions have come up. Remember, our focus here is to get you well, get you fit, get you healthy. The fitter and the healthier and the more well you are, the less likely you are to get any disease. And there's so many people that have received this unfortunate health condition who have a lot of comorbidities, and obesity is one of them. So that's what we're here for mostly, as you know, and to help you understand your body more. And I'm a very big believer that we need vitamin D, we need vitamin A, we need zinc, we need different kinds of immune products that I rotate personally every month. I absolutely love the Verasid product, and I have other ones I rotate in, elderberry, echinacea, mushrooms, and you got to have adequate vitamin D. So what we're asking is, if you do test here, consider the extra $40 to get your vitamin D levels tested. If you're taking vitamin D, You'll get to find out, are you taking enough? 60 to 90 is ideal in our world. If you're not taking vitamin D, this will help you to see, should you be taking vitamin D? Personally, I believe the better your vitamin D, the less intense, the less severe your symptoms are with most illnesses. The results will be back in 1 to 2 days. We will call you if it's a positive. We'll send you an email if it's a negative. Is fasting required? No, fasting is not required. And I think that's the main questions that are going to come up. IgG, IgA, IgM. If you had an illness months and months ago, and if it was related to this, you would probably show positive for the IgG, again, if that's what you had, because your body has made those antibodies. If you've been sick recently, your body goes through different phases, and it makes different antibodies to deal with the antigens and help the body to get well. So first, the IgM antibodies arrive on the scene to fight things off, then IgA, and then IgG. And for many people, this is very confusing. Let's face it, this is another world. But if you've had any viruses in the past, these are not new, this IgG language and this IgA language. It's one of those things where more people are paying attention because there's just so many things that are unknown right now. And whether you think you don't want to know or if you think you do want to know, it's up to you. I just want people that want peace of mind testing to have that peace of mind testing. And then, depending on what the results are, do something about it, especially if you decide to get your vitamin D levels tested. I can't talk about vitamin D enough. Anyway, thank you for paying attention. I hope this is helpful. I hope the email is clear. If you're interested in getting testing, please be patient with our new Click Schedule and Purchase software, and we will see you sometime soon. Remember, don't forget your mask if you're going to come in, and make sure you have an appointment. One person in the lobby at a time, preferably, so when you come up, if there's somebody in here, just please kindly wait outside. Thank you so much for watching.